We're speaking on the territory of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection to this land. I'm Janet Eremenko, Alberta NDP MLA for Calgary-Currie, and I'm joined by my colleague Lou-Anne Metz, MLA for Calgary-Varsity and critic for health. For the last week, I've heard from several of my constituents who go to a clinic in my riding. After many years of seeing the same doctor, they are suddenly getting emails that say they need to pay $4,000 or more in annual membership fees just to keep the same level of service. I was shocked to see these emails, and like many folks, I wondered if it was even legal. But let's remember a bit of context. The current Premier has spent her entire career in public life campaigning for Albertans to pay out of pocket for their health care. She's written a detailed policy paper on this for the University of Calgary. She's gone on an entire speaking tour to make this argument. She eagerly told interviewers that the government shouldn't cover checkups and that she wants to create a payment relationship between Albertans and their family doctor. During the election, Danielle Smith suddenly began claiming that she would never make some pay to see their family doctor. And that's what brings us here today, with Albertans now being asked to pay to see their family doctor. Exactly what Smith promised wouldn't happen. That is where I will leave you, and I will hand things off to Dr. Lou-Anne Metz for further comment.
Thank you, Janet. This is a very worrying development. To see Albertans now threatened with losing their family doctor if they don't pay thousands of dollars in costs. I know many people have asked if this is legal, and to the best of our knowledge, it hasn't been explicitly tested by the courts. They may skirt the outside of the Canada Health Act by offering appointments one day a week without the membership fee, so they can argue that all their insured services are still available. But this is giving preferred access to those who pay the fee. And while that might not clearly break the law, we all know that in real life, that simply won't work for people who need to see their family doctor right away on a regular basis. I primarily fault the provincial government for pushing these doctors into a situation where this is how they have to pay their bills. And I fault the province for allowing these membership fees to be charged. I'm very concerned that the province approves these fees then in a revenue stream which will be attractive to some other physicians in their own clinics. In addition, there's a risk that some health transfer payments to Alberta will be withheld. We know that families without ready access to primary care are going to end up in the emergency room. And I was very concerned to see that at the Peter Lougheed Hospital, the emergency spike time was 13 hours. The emergency visit time spiked to 13 hours again last night. So today I'm calling on Danielle Smith and Adriana LaGrange to tell Albertans whether they intend to do anything to stop these fears or whether they're quite happy to see Albertans pay out of pocket to see their family doctor. At the Alberta NDP, we are adamant that you get the care you need when you need it, close to home, and that you should never have to pay to see your family doctor. Thank you, and we'll now take your questions.
Okay, we'll start with questions in person, then move to the line.
Hi, it's Marcia from Global News. Do we have any proof that they are actually not accepting any of their other patients and that they used to see before they started charging?
So they have sent an email to their patients informing them of the new system and that they would need to pay if they want to have access on the previous basis, and they've thrown in a few extra perks for that, but that patients who don't pay will only have access 1 day per week for people that don't pay.
Okay, so the worry is that the 1 day per week, that's how they're skirting the system.
That's the concern, yes, by saying, yes, it's not a fee for access, but in fact it is, because now you just get very limited access if you don't pay the fee.
Do we have any proof, however, that people are not being seen?
Well, this just went out. This is brand new, and this is what they're telling patients is the new way going forward. Is that proof? I think it is.
Hi, sorry, Isabella with Livewire Calgary. For families that have already invested in the payment fee, if it is to be disqualified or wiped, how will this affect them and the people that have paid in to receive that primary care?
Well, this is a brand new fee, so I don't imagine there are people that have already paid it. It's just come out in the last week.
Mike Simon from CBC. Why wouldn't every doctor just do this now? Like a lot of doctors are, I mean, it's a real struggle now, isn't it? So why wouldn't all doctors just adopt this immediately? And second to that is, now these practices are run by corporations. So do you believe maybe it's the umbrella corporation that runs the practice that has driven the doctors to do this? Like, can we just keletonize that a bit? Maybe, if you know.
Most practices are not run by corporations. Most practices are run by individual physicians. And it is certainly a thing that when corporations take over that running practices, that it's more likely that there's going to be these fees charged, because the corporation is in it for making money. They have to be there. Corporation is to make money for shareholders. Why would a physician not do this? Because they don't believe that this is the right way to go, and it's really their conscience that would say, I can't do this. I'm providing care to my patients. And that is by far and away the majority of physicians. But we have a lot of things going on, a lot of chaos in the system, a lot of reasons why physicians can't make ends meet, why they may be retiring because they don't want to sign the next lease, because they can't commit to affording it, or they may move to another province where there are other opportunities to maybe be no better than here, but maybe it's closer to where their family is, so they will leave. And so, yeah, there's doctors that will do this, but the majority, I am sure, will not do this. But we have reasons to lose family doctors, and now we've got another one. Well, you can keep your doctor if you pay. I mean, we're talking thousands per year.
Any word from the Alberta Medical Association on a reaction?
I haven't heard anything yet. I don't know if there will be.
Why wouldn't there be? Why wouldn't the association react to something as this is, I mean, a real change? This is a 180 in a lot of ways from the way I was raised. I'm 62 years old.
I hope there will be a reaction to this, but they do represent all members, and so I think that it won't be an immediate reaction immediately at this time. And I think that one reaction would be to definitely call out the government for the things they have done to harming primary care.
Is it any coincidence that it's in a fairly well-to-do community too, do you think, this new practice?
I don't know.
Okay, we'll go to questions on the line. First question goes to Dean Bennett.
Thanks. So I see you're allowing more than one question, one follow-up. So I would appreciate a few questions as well. Luann, I'm looking for the background here on this, because your email says that this has been done in BC. What have you learned about what's happening with this in other provinces? Is this the first case that you found in Alberta? And my other question is, you say that it still has to be approved by the province. What's the process?
Well, the province's approval would be by just letting it continue. There isn't a formal process for approving this. The other provinces, certainly in BC, there had been over a number of years growing numbers of clinics. Often they are corporate clinics that have been charging people to participate in the clinic. Some of the response in BC has been that the government are putting quite a bit of effort into building primary care, and they are attracting quite a number of Alberta doctors that I'm aware of to not work in those clinics where people are charged necessarily, but to work in primary care because of they're building up the public system. So BC has been at the center of pay for care for a long time. You may be familiar with the Cambie case of the surgical clinics, and that went all the way to Supreme Court, and it was determined that the province can protect its access to getting federal health transfers by shutting down the fee-for-service outside of the usual Alberta healthcare funded services. So Alberta is using health transfers from the federal government if we skirt around the Health Act, but it is up to our government to decide if they want to let this happen and potentially forego those payments.
Is there a follow-up, Dean?
Yes. Yeah, well, I have more than one because I think you're taking more than one question, one follow today. So really, I mean, this is the first case in Alberta that you're hearing, right? And technically, I would think that the province could just tell this clinic, you're not going to be allowed to bill through Alberta Healthcare if you're going to use this model, right? They could do that. Is that right?
I'm not sure. I'd have to explore exactly how that works. There have been clinics that have done this in the past. So this is not the first example of this. There are corporate clinics, but whether there are clinics that already provide service to Albertans and then pull back by implementing this, I'm unaware of any others that have done that.
Okay, and it feels like, Luann, you're making two arguments here in terms of why they're doing it. You're saying in the case of this Marda Loop, it's because they need to do it to make a profit, to stay above water. But then you're saying others probably won't because they have a conscience and wouldn't overcharge. I mean, you don't know what the ruling is or what the rationale is for the Marda Loop clinic, do you? We don't know if maybe they're making a good amount of coin here, and this is just a way to pad the bottom line, isn't it?
Maybe we don't know that.
But
we do for sure know that primary care has been decimated by changes that this government has brought in, and so whether large numbers of physicians and their clinics start to do this or not, we know that there's this driver that it's very hard in many cases to operate a full service clinic because of changes that the government brought in.
This feels like there's a term in labor, right? Constructive dismissal. Is that what's going on here? I mean, if I don't want to pay this fee, I've got 1 day a week now to see my doctor. Effectively, they can't see the same number of patients. People will lose access to their family doctor here. Is that not ultimately what will happen here?
Yes.
Okay, thank you.
Okay, thanks. We'll go to our next caller.
Hi, thanks for taking my question. This is Lisa Johnson from the Edmonton Journal. I'm wondering, just to kind of follow up on what Dean was asking, what exactly can the government of Alberta do to regulate a clinic's operation like this? Because I've got a statement from Alberta Health saying that under the Canada Health Act, physicians can opt out of participating in government's health insurance plan, and once opted out, do not receive public funding. They say this is not new. And they're aware of 4 physicians who have chosen to opt out in Alberta. So I'm wondering what can the province actually do? I think you basically suggested that it's up to the province to kind of step in here? What can they do?
Well, they could, for one, ask these physicians to opt out of the Alberta Healthcare Plan so that they are offering a fully paid clinic resources, but not many, obviously, physicians will do that because they will lose majority of their patients who do not wish to pay for their own health services. The government can certainly let them know that this is skirting around and that they're putting the province at risk for health transfers. The process for that, I'm not sure, but we can explore that.
Is there a follow-up, Lisa?
Yeah, thanks. And I understand like this is all coming from an email sent to patients of the clinic, but I'm wondering if you've been in touch with any of these, anybody at the clinic, and if you have any insight as to whether or not this clinic does receive public funding or not, or if because you're suggesting that by staying open one day a week for open appointments, they could still be getting public funding, but or is it unclear from your perspective?
Oh, it's not. There's not a question. These physicians are still eligible and still be billing the healthcare system for every service they provide. It will be the same fee whether they're the 1 day a week people that do not pay the $4,000 or the others. They will still be able to bill the Alberta healthcare system for the health services that they provide. That isn't really a question.
Okay, thanks.
Okay, we got one more question in person here.
I'm going to play devil's advocate. And if this means more doctors, more family doctors for Albertans, is that not a good thing? When we're already paying for doctors' notes, we're paying for certain tests, we're paying for... Is this possibly an opening for so many people that don't have a family physician in Alberta?
Overall, we've seen that when you start paying separately, that your system costs you more, and that the people that are going to suffer are the people that can't afford to pay. So will this result in more? I doubt this is going to be the kind of incentive that's going to draw doctors here. I can't see it. But I guess we'd have to say, do we want to draw doctors here to see people that can afford to pay thousands per year?
Okay, and that's all for today. Thanks.